We welcome you all to Talk the Talk. My name is Janine Stiene,
And I'm Toni-Ann Antoniato.
the Masters of Myofunctional Therapy.
Together, we interview physicians, dentists, and other professionals to learn how their expertise can benefit you, your child, or your patient's speech and language skills and complement the services they are receiving. Joining us today is speech-language pathologist Robyn Merkel-Walsh. Robyn is a true leader in the field of speech, myofunctional therapy, oral motor therapy, oral placement therapy, with more than 2 decades in the field. She is employed full-time with the school district, runs a private practice in New Jersey. She's a lecturer and author for Talk Tools, a professor on orofacial myofunctional disorders, and the board chair of the Oral Motor Institute. Robyn is a well-respected subject matter expert, and we are fortunate to have the opportunity to know her. Thank you, Robyn, for joining us on this episode of Talk the Talk.
Thank you for having me. I'm honored.
Thank you.
Thank you. You have definitely been a pioneer when it comes to oral motor therapy, myofunctional therapy. Definitely someone that Toni-Ann and I have looked to for education and guidance, and have also grown our skill set. But take a moment to share a little bit about what your career path has looked like and your journey as a speech language pathologist.
Well, I was really lucky because I had the pleasure of my aunt being a speech language pathologist. So I actually, true story, was supposed to become a Rockette. I danced my whole life. I
Okay.
went to the Carol Hayes studio in Jersey City and New Jersey, and my dancing school teacher was a former Rockette. So they had like this program that you could pre-try out before you were 18. I was the right height, right weight, the whole thing. I got pre-selected, but I really wanted to go to college. So, I basically learned very quickly, like, well, what are you going to do when it's not Christmas?
Right.
Like, what's going to happen? So I started auditioning for programs with Bachelor of the Fine Arts in Dance. And I did Rutgers, had a dance program at the time, Montclair State, NYU. I got into NYU and Montclair State and waitlisted at Rutgers. And, they say everything happens for a reason. I registered, enrolled in Montclair State. I was living on campus and doing the dance major program, but I really didn't like it because I came from a background of jazz and tap, and this is when contemporary dance really started coming into play. And my professor was like, lay on the floor and act like a fish. I'm like, what? I don't like this. And I had gotten really sick, and my aunt was a clinical supervisor at Montclair State. And she was over in what was then the K building. Montclair State has since opened a whole speech therapy clinic off campus. And she's like, I made you a care package, come pick it up. And I walked in, I was asking where she was, and it was the two-way, mirror glass as we have in the clinic. And she was feeding a baby with a diagnosis of Down syndrome. And I said to her, I want to change majors. And this is when speech pathology at Montclair was still undergraduate. And I went the next day and they accepted me. So I had my aunt to guide me, and she would take me with her to state, like the New Jersey Speech and Hearing Association, to convention. And that's when I first heard Sarah Rosenfeld Johnson speak. It was the senior year of college. And I had a project to do for my articulation and phonology class. And Emma Cortesi was my professor, and she was doing her doctoral degree at the time under Barbara Hodson. So you can imagine what happened when I pulled out horns that I learned from Sarah Rosenfeld Johnson to teach the L sound, right? And the controversy wasn't that big back then. I mean, I'm aging myself, but this was in 1992, 1993. So when I went to graduate school, I had the pleasure of Dr. Atanasio, Dr. Caracola, may he rest in peace. And they were very open about Dan Garliner and myofunctional therapy, and kids may have a tongue tie. And they actually taught us about these disorders. So it was just a natural progression that I learned about it in school. And then I was emergency certified. That was kind of popular back in the early 90s. They couldn't find speech therapists. You could name your price in the schools back then. And I worked in a private school, but then I got offered a position in a public school. And I was a little disappointed because they put me with general ed. So as the kids started coming in, I was noticing, I'm like, why are these kids' mouths like the kids' mouths of, craniofacial diagnoses or Down syndrome diagnoses or low tone diagnoses? And I started taking more classes. I was already training with Sarah and Lori and doing a lot of that work. But then Diane Barr, Pam Marshala, Sharp Beauchart, Bob Mason, the Zimmermans, Sandra Holtzman. I took a whole bunch of classes. Roberta Pierce, also, may she rest in peace, one of my first mentors. And I started developing the SMILE program. And I wrote, now imagine this, there was no email. I wrote Sarah Johnson a handwritten letter. Okay?
Yep. Mhm.
How old I am.
Did you use a
all right?
quill?
We're in the third, it's actually not over 2 decades now. I'm in the third decade of speech pathology. And I wrote her a letter and I said, listen, I'm, working on this program. These kids at school, they all have these oral motor and myofunctional issues. I have 6th graders that suck their thumb. Why are all these kids tongue-tied? I thought it was like this rare anomaly. And I got a phone call at home and she's like, is this Robyn? This is Sarah Rosenfeld Johnson. And I remember I just stood in my kitchen like this. Like Michael Jackson called me or Lionel Richie or one of my favorite singers. And she told me that she wanted to meet with me and history was made.
Wow.
I put the SMILE program together, which by the way is going to be launching very, very soon. It's completely like rebranded and redone. You'll be excited to see it, to go in line with my Myo Tools series that I teach. Just everything I've learned over the past 30 years. I've rewritten that program so many times, and Talk Tools is so gracious when I say this needs to be redone for this reason. But this has really just been, Lori and I always talk about the journey, but it's more than a journey. It's like a series of novels. Like I feel like when I was a kid, I read all those Flowers in the Attic or, whatever novels. It's different novels and evolution over the years. And never did I think I'd see the day and all the advocacy and fighting the controversy and the non-speech oral motor exercises that we'd get to a point where we would be saying too many people are doing Myo, like everyone's got to stay in their lane.
Right.
Yeah. No, yeah.
So we've gone from very few people know about it to people are really ticked off about it. That's not evidence-based to, I just graduated high school. Can I do Myo?
Yeah. No, yeah. Mhm.
Right?
Yeah.
So it's good to know that when I was talking about tongue ties in like 1996 and people were like, what? I was teaching courses and saying, if you're working with kids with lisps, you need to check for a tongue tie. And they're like, why? And now it's made the New York Times, it's made the Inside Edition. So
Yeah.
that's the condensed version of the cliff notes of my journey as a speech pathologist.
Amazing, so much. And obviously you do so much advocacy in the field. You're now the chair of the board chair of the Oral Motor Institute. What is, your mission there? What are you looking to do with that Oral Motor Institute?
So when the Oral Motor Institute was founded by Pam Marshala, the main purpose was for the science of oral motor, mainly to write monographs. Pam wrote the first monographs, Diane Barr, Sarah Johnson, then Lori and I. And quite frankly, it was basically to combat Dr. Gregory Loff and his thoughts that all oral motor exercises were non-speech and there was no research about it, and people really misunderstood this to be an ASHA position statement. And the early papers of the Oral Motor Institute were to negate that, and our founding members were all the best: Leslie Faye Davis and Susan Evans Morris and Nancy Kaufman and Lori Overland and Sarah Johnson and Stephen Sachs and Donna Ridley. Then I got invited to be on the board, which was amazing. And then Pam got sick with leukemia. So one of Pam's dying wishes is that the Oral Motor Institute would continue, but it would continue to evolve. And she said, Robyn, whatever direction you think the OMI needs to go in, because as you know, it's an ebb and flow and it's like a pendulum where we'll be popular one day again, and then we'll be not popular one day again.
Yeah.
And it's really grown and changed over the past couple of years based on need. So right now, we've just written new mission statements, new vision statements. The website should be launched either tomorrow or Thursday. I just finished the last editing process. And, we're about ethics, advocacy, education, and evidence. So some of our current missions, for example, is we're advocating, we just started a position. Caitlin Schrum actually had the idea, and we backed her up in writing to ASHA, because every year there's a convention. Every year, all the clinical topic areas in the ASHA practice portal have representation. There's a speech sound disorders without hearing loss. There's a speech sound disorders with hearing loss. There's dysphagia. There's pediatric dysphagia in feeding. There's motor speech. There's craniosacral disorders, right? There's no oral facial malfunctional disorders. So
Yeah.
Therapists like myself submit a paper, and I have to sit there and go, well, is this craniofacial? No, because it's not cleft palate, but is it a speech sound disorder? Well, it is motor execution, but it's caused by a structural anomaly. So where do I send it to? And I have submitted speech and TOTS for 5 years, and they keep giving me feedback like it's too one-sided. So I put more papers that are anti-TOTS in speech, and then they say the sources aren't good enough, but it's the American Journal of Speech Pathology that's published by ASHA.
Right.
Or it's biased because I work for Talk Tools. And I thought it was just me, but I found out it was many other speech pathologists that were facing this. So we started this petition because we want ASHA to know it's not just Robyn Merkel-Walsh
Right.
that's having this issue, right? Because it's not blind peer review, it's open review. And they see me and they think I'm trying to sell tools. And the funny part about it is my lecture that I want to do has nothing to do with tools. It has to do with science and it's a literature review of looking at studies that have shown a correlation between tongue tie and speech sound disorders and those that have not, so that's an example. Another example is that we feel very strongly that speech pathologists have speech pathology licenses and that we're not myofunctional therapists. Myofunctional therapy is a modality that falls under the ASHA scope of practice and under state licenses under the divisions of oral peripheral exam, swallowing, speech, respiration, phonation, And we want speech pathologists to get involved in this area, but we believe in the highest degree,
Mhm.
right? So if you are seeing patients and you're calling yourself a myofunctional therapist, for example, what happens if something goes wrong in therapy? It's not going to be liability insurance under a myofunctional therapist. It's going to be under your license. So we really want not only speech pathologists, but other professionals to look at this as orofacial myofunctional disorders that happen across the lifespan. And many different professionals treat these disorders with different modalities. So an infant can be born with a tongue tie, but we don't treat them with myofunctional therapy. They are treated with lactation support. They are treated with oral motor therapy. They may be treated with chiropractic care, body work, or physical therapy. None of those modalities are myofunctional therapy. Or you can have an adult with a degenerative disease that compensated their whole life, like ALS, but all of a sudden they can't swallow and we figure out they have a tongue tie. They're not going to be able to engage in the volitional control that myofunctional therapy requires, but we're certainly going to work with evidence-based dysphagia techniques to make sure they don't aspirate or have penetration, right? So that's a second thing that we're working on. And there'll be more efforts. You know, we feel that semantics are important. We feel that scope of practice and licensure are important. We feel that looking at all the tiers that ASHA teaches us about evidence are important. And we feel that interprofessional collaboration is important. So sometimes our message is misconstrued, like we're against other professions. It's not that. We just, you know, as SLPs, we, as you know, because you did it yourself, we have an undergraduate degree. And if we were lucky enough to be old like myself, I went to school undergraduate for speech. So I didn't have to take all these prerequisite classes that a lot of the new clinicians have to take. And then we get a master's degree and we have to do 400 hours of clinic, and it has to be in all these different areas of scope of practice, and it has to be across different ages. And then we need clinical supervision, and then we need to pass a praxis, and we have to apply for our license, and in some states a school certificate. And then we still need another 9 months of fellowship. And then we have to wait for the state to send the papers. We get a job and then we can't even work because we're waiting for the papers to come through. And then we need continuing education. And then we're told by the bylaws of our licensure what we can do and can't do. And at OMI, we just want other professions to hold up to the same accountability because it protects the public and it protects us. Who wants to be sued because we didn't dot an I somewhere?
Exactly.
You know, so you know, we're kind of looking at both sides, the patients or students or clinicians, and also the professionals, and making sure everyone is protected during these services. Because, you know, I hear sometimes people say, well, it's just about oral resting posture. No, it's not. And you ladies are great at oral resting posture, but you also know that there's so many more pieces to that puzzle.
Exactly, right. And I think that it's so important to, you know, protect that scope of practice because like you said, it's for the patients, but it's also that stay in your lane kind of mentality of wanting to make sure that we're doing for the patients what's going to be right for them. Because if we have a patient that presents with a tongue thrust, but we see motor planning difficulties, we're not going to treat that patient like a myo patient. We have to be able to take our other specialties into account as well.
And that's the thing. If we're categorized as myofunctional therapists, we lose all of that. Because I can have a 5-year-old come in my office and know the difference between low tone, high tone, compensations, fixing, apraxia, dysarthria, a phonological disorder. And if you're only trained in one way. If
Yep.
you've only done myofunctional therapy training, everything's going to look like a myofunctional disorder.
Right.
Yep.
My dear friend, Dr. Toni-Ann, he says to me, if you have a hammer, everything looks like a nail.
I like that. I like that.
Yeah.
You need a broader training and idea and ideology that not everything is caused by a tongue tie, not everything is apraxia. This happened in the 90s
Yeah.
when childhood apraxia of speech became accepted as a diagnosis. All the kids had apraxia and they all needed 5 hours a week of prompt therapy.
Yep.
Yeah.
And I love prompt therapy. I
Yep.
think prompt therapy is fabulous. I've been doing it for 23 years. But with that being said, I see patients that come in my office that the neurologist says they're apraxic or they're dyspraxic, which isn't even, as we know, the proper terminology, right, for childhood apraxia of speech. And they are so tongue-tied that, my husband could diagnose it at this point. Like, I mean, he's heard Dr. Zaghi lecture.
Of course. Yep.
He's a myofunctional therapist.
Yep.
But it's just so true. Like, not to be overly zealous or proud of our profession, but I am, because we have that ability to do all those different trainings and really look intricately. I teach a class that's entitled Structure, Muscle, Motor.
Yeah.
And many of the times it's all of the things.
Exactly. And
You
different.
you get a kid, you do pre-op neuromuscular re-education, they go for the release, you're so excited and you're like, wow, this kid also has motor speech delay.
Yep.
Yeah.
It's not just the tongue tie, it's the motor system too.
Yep.
And that cannot be treated by a classic myofunctional program. So I think that this is something we really need to drive home, like with our orthodontists and release providers, because they're lumping everything into myofunctional therapy, whether it's an RDH or an SLP or an OT, even a lactation consultant. Like, they think we do all the same things: stretches,
Yep.
best posture, work before and after surgery. And it's so much more than that.
Do you think we'll see a standardization with regards to myofunctional therapy? I feel like you can be trained in by so many different organizations now. But there's not a continuity amongst them. So it's, how do you determine which organization is giving the therapist the best tools to work with in terms of their patients?
Well, I'm a little disheartened by what's happening in terms of training. And, for 50 years, the IOM was the gold standard, and all I can say about it is that anything that's new and any new certification is going to have some core values or basic foundations that came from the IOM.
Right.
Because when you look at who's teaching for the AOMT, let's say,
Yep.
some of the original founders started with the IAOM and were IAOM instructors. And I'm not saying that that's a good or a bad thing. It's just a factual thing. Sandra Holtzman's program, she was an IAOM instructor. So her foundations came from Bob Mason, who was heavily, embedded into the IAOM. When you look at, some of the privatized programs that aren't coming from an organization, let's say, consumers have to be aware that there's various types of certification, and the OMI talks about this on a new website. But there's company specific certifications. Like, I work for Talk Tools for many years as a consultant. We don't offer a certification because we know we can't monitor it.
Right.
No authority to do that, right?
Yep.
What we offer is a levels program. You take courses and you build your skill, and you can say, with honesty, these are the courses I've taken, or, you know, I've gone through the level 3 or 4 program where I've observed a clinician and I've been observed,
Mhm.
right? Or you can take prompt and you can do different levels, but
Mhm.
that's company specific. You're
Yep.
only certified in one method that's standardized. I'm not so sure that any of these certifications anymore in orofacial myology mean what they used to mean, because as you said, they're teaching different principles. So like one instructor may heavily focus on oral resting posture, and only oral resting posture moves the teeth, where the next instructor has a background in 0 to 3 in feeding. So they approach a lot of it from a swallowing point of view. And then the graduates think that myofunctional therapy is feeding therapy.
Mhm.
Yep.
Mhm.
You know, I'm very impressed with the work that the Breathe Institute does. I am a guest faculty member for them. I think what is beautiful about the Breathe Institute is they're not trying to sell a certification,
Mhm. Mhm.
but
Right.
rather a really rounded look at all the different professionals and what they contribute to orofacial myology.
Yep.
Mhm.
And the research is coming out of this institution. Like Dr. Zaghi is tireless, and he's not afraid to say, I did this paper and I found this, but you know what? I think I was wrong. And he listens, like he listens to the therapist, he listens to the dentist, he listens to his staff. And I have a lot of respect for that, because I'm often changing the way I'm doing things.
Mhm.
So I'm not against certifications. I just think consumers need to be clear on, are they getting an industry-wide certification? Like the CCC in speech pathology is standardized.
Right.
Right.
Universities have a criteria of what they have to teach to be accredited, which
Yep.
includes, by the way, orofacial myofunctional disorders.
Which is great, because that
Yay.
did not always, was not always the case.
Right, right. They have a standard, everyone does the same amount of hours, everyone takes the same test, everyone does the same, that is industry-wide.
Yep.
In my opinion, there is no industry-wide orofacial myofunctional certification at this point in time,
Mhm.
because IAOM has changed their criteria. You know, you can take any class and then apply to get the COM. So it does change things, because not every teacher is teaching the same thing. And
Yep.
again, you know, when I look at a lot of the instructors now that are teaching, they're students of Mary Billings, they're students of Christy Gatto, they're students of Sandra Holtzman, they're students of Kimberly Banker, they're students of mine.
Right.
Mhm.
You know, so I've been doing this for 30 years, you know, and look, you know, like a Star Wars analogy, when the student becomes the master, we
Yeah.
need new masters, we need new educators, and they're bringing in their own view.
Yep.
And I'm totally for that. I want the next generations to pass this on.
Mhm.
But there are a lot of people saying, well, this is going to become its own profession. Look how long it took speech pathology to standardize, right? What I would like to see is a postgraduate in universities, like I'm in the vocology program at Lamar University, specifically because I want to help professional voice users with myofunctional disorders. I'm not planning on, and believe me, I have to sing for homework, and I'm sure those professors, I had a great voice when I was young. I did choir and all of that, but I'm 53 years old and I am no Mariah Carey. So I don't think that I'm at an age where I'm going to get out a piano and start, you know, picking repertoire, but I'm enjoying learning about it. I really want my niche to be, you know, if you are a professional voice user, whether it's a lecturer like myself or a teacher or a pop singer or an opera singer, and you have a tongue tie, I want to know enough about that. And there really is a connection to tongue tie and voice, right?
Mhm.
So doing that vocology program, it's an 18 credit program. It's very intense. that would be something I would like to see, like a postgraduate.
Mhm,
I don't think 18 credits might not be enough for Myo, but
mhm.
let's say it's 21 credits or whatever, between 18 and 32 credits, something to this effect, where to take it, you have to have a master's degree.
Yep.
That's the standard. And then it could be open to a variety of professionals. But again, it all comes down to scope of practice.
Right.
Yep.
Right.
Absolutely.
And even in our own field, I tell therapists all the time when I teach, you don't have wound care and scope of practice. ASHA doesn't say we could pop open wounds.
Right.
And even though the research is there for TMJ, for sleep disordered breathing, and for pre and post on tongue tie, there's no state license. I looked at every license in the United States. There's no speech pathology license that says we treat sleep or TMJ.
Mhm, mhm. Interesting.
And
Interesting.
we have to worry too about, okay, we're doing that. And I've asked Asha about it, and the answer was you have to use, the evidence map. Like if you're seeing evidence and you're doing what does that mean? Are they giving us a green light? Are they going to back us up if someone files an ethics complaint? The therapist down the block from me is treating sleep apnea with myofunctional therapy. What would happen in that case?
Wow.
Yeah.
Right? Look what happened
Yep.
with the New York Times with the lactation consultant who was doing wound care without, without a nursing degree or whatever she needed to do that in her state, because at a lactation CE course, a release provider taught all the lactation consultants what a deep stretch is.
Mhm.
Right.
And we learn that, right? We go
Yep.
to conventions and we hear
Yep.
this stuff, but we have to know the boundaries.
Yeah.
Yep.
Mhm, mhm.
The way I lift a tongue looks the same way, my release provider says to lift the tongue. But in my mind, I'm thinking about goals. How is this helping feeding, resting posture, speech?
Right. Exactly.
And that was a recent paper that Lori and I wrote, kind of pleading to the release providers. You don't need these aggressive stretches if you use the right tools, if you use function to guide the healing process.
Mhm.
So
Okay.
there's so many layers of all of this. And,
Mhm.
I respect everybody that's out there teaching. I get that people are trying to make different standardized processes, but we have to get, to the point of our career. Am I going to be Robyn Merkel-Walsh, A, B, C, D, E, F, G?
Yes.
Like how many letters am I going to
There's
be?
already
Right.
so many, right?
Right.
Exactly.
And, some of it to me, when I look at a speech pathologist that, let's say, has a com and a quam, right?
Mhm.
Because they were at that cusp where that instructor broke off from the IAOM.
Mhm.
Don't disrespect that. Everybody, changes. You want to do different things. But they took one class and the IAOM let them take the exam. And Holtzman let them take the exam. So now they look like they have more certifications than I have.
Right.
Yep.
Mhm.
But it really was one class that allowed them to get 2 different certs.
Yep.
Mhm.
Or what about instructors that certify themselves with the letters, but they're the instructor? Who
Yeah.
certified them?
Right.
Yeah.
Yeah. So true.
Mhm.
Yep.
So we have to think about this when we go out and teach, when we go out and take a class, because we want to be transparent to our patients and to one another.
Mhm. Mhm.
Absolutely.
Yeah.
Absolutely.
Like I'm a firm believer, sign as much as you want. I have a bunch of stuff after my name. I'm ICAP board of directors. I'm the board chair of the OMI. I'm Beckman trained. I'm prompt trained. But I put that because people will call me, you prompt certified. No, I'm not. I'm prompt trained.
Right.
Yeah.
Yeah.
That's what we
That's
say.
more of a disclosure that I can
Yeah.
do this therapy, but I'm nowhere near the level of, let's say, my really good friend, Dr. Jennifer Moore, who's a prompt instructor.
Mhm.
Yep.
Right.
So I think that to truly be a really good speech pathologist who wants to specialize in orofacial myofunctional sciences, you have to learn about 0 to 3 development. You need to know normal to understand abnormal.
Yeah.
You need to understand how feeding and swallowing develops.
Yep.
It's like jumping in the middle of a soap opera series to
Mhm.
just learn myo
Yeah.
Mhm.
and nothing that happens before it. It's like my husband gets mad and my son when I fall asleep during a movie and I wake up and I'm like, what happened?
Right.
They're like, no, we're not
Yeah.
telling you anything.
Yep.
You were sleeping. And that's kind of how I feel. Like if you don't learn that across the lifespan, you're missing a piece. And you don't have to like working with babies, and you can never have a baby in your practice for your entire career. But you need to learn what happens in utero. There's a reason they teach us multiple courses of anatomy, physiology, biology, neurophysiology.
Yep.
I hated it in school. I never dreamed that I would end up in this kind of work. I used to literally vomit when I had to take a neurology exam. I was in the bathroom sick. And now it's just like, second nature. But, we're all here to learn from each other and help each other.
Yeah.
Like I've learned great things from my graduate students that are here interning with me. I'm like, that's brilliant.
Right.
And I'll cite them.
Yeah.
Do you think the pendulum has swung this way where people are more accepting because there's more research coming out of the United States? Or are people more open-minded?
I think social media has a lot to do with it.
Wow. Okay.
I think I think that oral motor and oral facial myofunctional therapy is a real thing that has science and evidence behind it. But I think many people are getting on board with it because everyone else is doing it. I'm not so sure that everyone who does it right now is a true supporter, or that was their, real passion. Like in graduate school, I want to do oral motor therapy. I think that if everyone went on TikTok and said the thing to eat is pickles,
Yep.
you see a greater variety of pickles in the store. I still don't think who we really need behind it, like ASHA, like our state licensing boards, or academia. I don't think that at that level, they're really accepting it, because if they did, we would have better representation at state conferences, at national conferences. We're in a circle. If you're going to a conference, I'm probably going to a conference. And if you're not going, I'm going, and I'm going to tell you what happened, right?
Yep.
Yeah.
Where are we going to be? ICAP, IAOM, AAPMD, American Laser Study Club. That's where we're going to be.
Right.
Yep.
But are we reaching the people that don't know? We're all like-minded professionals. We need to be at our state associations. We need to be at the ASHA convention, presenting case studies, case series, cohort studies, prospective studies, retrospective studies.
Yeah. It feels like we've come so far, yet have so much more to come.
Yeah, totally. And, and part of the problem is that if everybody's in a different camp, like some speech pathologists are with this organization that's against that organization, or, everybody's trying to find a place where they feel comfortable.
Right.
And like you said, the lack of standardization causes that too, because it becomes competitive. Well, is this certification better than that certification? How about we focus on our education and being good therapists?
Yep.
Yeah.
So true. Yep. The more you know, the better you can service your patients on all levels.
Right. And work
I
together.
did orofacial myofunctional therapy since 1995, and I didn't get certified with a COM until 2018.
Yep.
Yeah.
Yeah, it's true. That's it's not, it's been so varied, being trained through the IOM and then being trained through AUMT, and which certification at one point it was like, which one do you go with? Does it, matter? And I know there's a lot of reciprocity now, which is great, but it became a sticky place to be for a little while.
Yeah, for sure. And it's almost like, picture a high school team, like our area is very small here. So Richfield and Powell Park are next to each other, right? So when I was in high school, there was a football game, you're wearing the jersey because you're representing your town, but like your friend is playing for the other team and you're right on the fields with them, and you're going out to the diner after, you can still all be friends.
Right.
Yep.
Mhm.
Yep.
It doesn't have to be such animosity.
Right.
Yep.
But I think that because so many professions are involved, like I recognize PTs, for example, have so much to offer, right? Because they can work on tension in the whole body. I go to a PT for TMJ. I'm not going to a speech pathologist or a myofunctional therapist. I go to a PT. That's amazing. But should they be doing articulation drills under the umbrella of myofunctional therapy? I don't think so.
Agreed.
And it took a while for SLPs, and some still don't want PTs in the myofunctional arena because it's scary, because this is our livelihood, and they can do multiple modalities and bill insurance because they can work on neuromuscular reeducation in any muscle in the body.
Yep.
So even myself, I was all riled up. Like, what do you mean PTs are going to get certified in Myo? Like, don't they have enough to do? They work on the back, the knee, the neck. Believe me, I got an ailment in every joint. I know the PT very well, but, as I kept an open mind and listened to what they have to offer, that's when I really started teaching in my classes. Again, orofacial myofunctional disorders occur across the lifespan. The way we treat them is based on the age, the cognitive status, and the problems that the patient presents with.
Right.
Someone can have TMJ and never need a speech pathologist or an RDH who does myofunctional therapy.
Yep.
They could just be seeing a PT, or the main problem could be a list, and they're never going to need body work.
Right.
Right? So
Yep.
we all have a role, and Mary Billings is really big in driving this home with me. Robyn, focus on the diagnosis and not the MFT, OMT, myo concept.
Yep.
Focus on the diagnosis. And, we're not fluency therapists. We never walk around as SLP and say, hi, I'm a fluency therapist, or
Right.
I'm a prompt therapist, or I'm a phonological therapist. We
Right.
say we're a speech therapist. So
Right.
why for myofunctional disorders is it any different?
It's a very good point.
That's a really good point.
Yeah, definitely. Okay, so let's talk about something in terms of, obviously you do a lot with research, and you're an advocate for the importance of research, but you also are an advocate for the importance of clinical experience, and that sometimes things cannot be in research. So tell us a little bit on that and why you feel like that clinical experience side is sometimes neglected when people talk about the evidence-based practice.
The elitists.
That's a good
So
question, Toni-Ann. Good question.
everything we do today in clinic, down to the forms we use or how we code or stickers. I always say, show me the research study. I want a level 1, systematic review or an RCT on stickers. The kids are going to come in and half the kids are going to get stickers and half them don't. Do we need that? No, we know that kids like prizes, kids like stickers. And I feel safe enough with studies that have been done in behavioral psychology on positive reinforcement that I can use it in speech pathology and not need a specific sticker study
Right.
for giving a kid a sticker, right?
Yep.
Yeah.
There's no study that using a mirror helps a child achieve a sound faster, but we all know that it does.
Mhm.
So there has to be a balance. So every, game we play that we do and every phonemic cue that we do, someone that was a clinician made that up in their clinic. And all I have to say is this. Imagine this book by Pam Marshalla, Oral Motor is Not Evidence-Based. Look at the thickness of this book.
Yeah.
Yes.
And when you open it up, it talks about the foundations of Van Riper from 1905. It talks about how we started as elocutionists in the 1700s.
Yeah.
And we were using tools and we were talking about breathing and the 7 errors of speech pathology, the first one being in Greece and Rome in 500 BC to AD01. And guess what? They were using oral motor therapy because probably a man back then, in a what do you call those? The Greek, Tonga,
A turban, not turban, what is it called?
Tonga,
Yeah. What?
aphasia.
Oh my God, you know what I'm talking about?
Yes, I know exactly what it is.
You wear the rope around your thing. It's not a turban. It's not a tunic. What is it called?
Or some leaves covering their private parts.
Yes, exactly.
Teaching someone to put their tongue up for a sound, so research starts in the clinic. And Dr. Baxter and I gave a lecture as keynote speakers at the ICAP conference, Teamwork Makes the Dream Work. And people will say to me, how did you get to do research with Dr. Baxter? I'm like, I had breakfast with him one day in Delray. And, I know a lot about clinical stuff and he knows a lot about data and we work well together. It's knowing that you can take beautiful data in your clinic and it creates patterns. Case studies or research, case series or research. Dr. Baxter and I just did another paper. It's a case series to open the door because it gives, I'm not this, I don't have a Zaggy mind, I don't know how to put together, or Dr. Ray Zhang, incredible, because he's a DDS and he's a PhD, and him and Sharon Smart, they know research design like this. But they need someone like me and you that's in the clinic and seeing patterns. So we can say, listen, I'm seeing this. How do we put it into a study? And what Dr. Baxter and I have really proved is you don't need 10 PhDs to write a paper. You can take the clinical mind and the research mind and the medical mind, and we can come together and bring our unique skills to get these studies published.
Okay.
And it really is a grueling process. I mean, I've published in the IJOM several times, and I've learned more from Dr. Nancy Solomon about writing in this journey over the past couple years than I learned in my entire career. And it's not fun to have something that you've worked so hard on and you think is this masterpiece and get it back with like 5,000 like red marks. And there's cursing and there's wine. There may even be bourbon involved sometimes when it gets really stressful. But all you have to say to yourself is when this paper is published, some child somewhere is going to have a speech therapist that says, you know what? It does make a difference to do preoperative work, or it can help a child with autism releasing their tongue tie, or there is a better situation when you do pre and post-op care, then maybe it'll think maybe it'll make a dentist think twice before he just snips a tongue and doesn't do any pre or post-op work.
Right.
Yeah.
So clinicians cannot discredit themselves that they're not researchers because they're the ones taking the data every day.
Yeah.
You know, Dr. Zaghi didn't get those 300 and what is it, 47 patients in his study to do lingual palatal suctioning because there were no therapists doing therapy.
Right.
Exactly.
Yeah.
You know, so we need that mutual respect.
Right. Exactly. Yeah. We have the clinical mind and then they could put it into the number mind.
Right. I'm starting to learn the number mind a little better. It's coming along, but you know, my hope is just to inspire people. Like I get pretty much, if I publish a paper, it's pretty much like my equivalent of going to Disney World or New York City. It's like
Okay.
waking up on Christmas morning and seeing those presents
Aw.
under the tree like a 5-year-old. It's an amazing experience. It really is.
Yeah.
Well, what you've accomplished
choked up.
and
Oh.
yeah.
No, it just, because when I was in school, I had a professor that told me I was a bad writer. And I always thought, you know, I had very high SAT scores and GRE scores, and I thought I was a good writer, that like literature was my area of strength. And I had this professor that really, really brought me down. And when I taught this summer for Brescia, I had students that are really early, you know, writers. And I told them, I'm going to give you a lot of edits because I want to help you and teach you the right way. You know, I'm not trying to criticize you, but if you want to do this work, you have to learn to do it right, like citations and things like that. And I realized, you know what? I did write a bad paper in graduate school. You know, APA is really grueling.
Yes.
Really grueling. And, you know, nothing that's online is helpful. Like you go to PubMed and you're supposed to copy a citation and it never comes out right. Like the title is supposed to be in sentence case, but then the journal is supposed to be in caps, like every word capitalized, and it always reverses it. So like my master mile list that I have for Talk Tools, it drives me crazy because it's so sloppy. But I need a volunteer to like sit there and do all the formatting. I can't get that info out to all of you by worrying about, you know, fixing all the capitals, because that's what PubMed is giving me.
Right.
You know, I find the article, I copy and paste it, boom, it's in there.
Right.
Because I want everyone to have instant access to it. It's one of my projects when this coursework is over.
Okay.
Well, you definitely do so much.
I can't
and,
believe,
yeah.
I swear when you talk, I feel like I'm very lazy and I need to up my game a little bit. I don't know how you find the time.
People say this to me. I don't know. I think it's the way I grew up. Like my mom was a single mom.
Okay.
And she had to hustle and work. And, you know, from a very young age, I was put in a position where I had to hustle and work. It wasn't like when I grew up in middle school and high school, I grew up in an area where everyone had like designer clothes and designer pocketbooks. And my mother's like, yeah, those things are great. Get a job.
Yeah.
So I was very motivated. Or when I
Yeah.
went to school, you know, to college and graduate school, my parents couldn't afford it. And I didn't want to have debt.
Yeah.
So I worked while I went to school and I got used to organizing my time. And I guess at some point I'll say, all right, that's enough, you know. But for now, I feel like my job is to help people. And while I can do it, I'm going to do it.
Our last question, what would your advice be to new therapists coming into the field? And where they should go with regards to their education and training?
I think that it's going to be very in line with what I teach in my classes. You know, I have like these infographics, and I always say, as I said before, start with normal.
Yep.
Go to the, you know, OGs, right? The
Mhm.
original gangsters.
Yep.
Go to the OGs and learn from the original source, right? And I'm
Yep.
talking about go take Lori Overland's feeding class.
Mhm.
Go take the Talk Tools, level 1 OPT 1 and 2. Go online and take some of Pam Marshalla's, videos, because they're still relevant and they still have the right information.
Mhm.
Seek out Char Beauchart.
Mhm.
Take her courses. If you can get your hands on teachings of Jerry Logeman, Catherine Shaker, right? The very great therapists that all of the other therapists that are teaching now today learned from, right?
Yep.
Or
Yes.
disciples like me, that it went from Pam to Sarah to me to
Yep.
you and whoever else is learning it. And then take the new therapists and the new ideas and, Autumn Henning and Hallie Balkin and the lecturers that are teaching these orofacial myofunctional classes, even our new educational partners at Talk Tools like yourself and Vanessa Anderson Smith, because they're going to take those foundations and add their ideas just like you have, right?
Yep.
And get that foundation of normal, of true oral motor, because oral motor is the umbrella,
Yes.
and the motor speech and the tone and the myofunctional and the pre-feeding and the feeding, it all overlaps and interacts.
Yep.
But I think that orofacial myofunctional therapy gets a little bit dummied down, like it's this simple cookie cutter, tongue to the spot, breathe through your nose, and all of these other aspects of motor speech, of feeding, of swallowing. And that's what I teach in my class, the 4 myodomains. You have your airway, which encompasses breathing, sleep, and oral resting posture. You have feeding and swallowing. You have structure and you have speech, and they all interact with one another. So you're not going to really truly get a good education by just doing an overview. You have to dive deep into those 4 areas.
Mhm.
So you need to learn like more about the anatomy and physiology of breathing and even how it deals with the voice. Like being in vocology, it is like oral motor.
Mhm.
It's all about articulatory positions, breathing, vibration, resonation. You need to learn about that because, oh, what's the big deal? It's just myofunctional therapy. Someone could aspirate and die.
Yep.
We're talking about swallowing.
Yep.
This is no joke, right? So you have to dive deep. And that's why I could put out a 28-hour class. I taught for Brescia, right? I could add a little bit more to that and have an intro class. I don't want to teach that because I want to have a series where any one of those topics, I can take a deeper dive. Like TOTS is a deeper dive into the structural component of orofacial myology.
Yep.
Swallowing is a deeper dive, right? So I think that people need to take the components and put them together
Okay.
and not think that in one introductory class for 28 hours, you're now a myofunctional therapist and you could put that on your website and you can treat the disorder because
Yep.
the disorder involves so much more. And the second advice that I would give is you really need a mentor. And I know your story, Janine, you mentored Toni, and now Toni's a rock star.
Yep.
I've mentored graduate students. I do mentorships here at the office and help with difficult cases, or just getting on a Zoom and answering the question, that you're asking me, like, what do I do? I'm so overwhelmed. Go to the OGs, learn the 0 to 3 development, and start chipping away and, everybody has a different learning style. You want a program that is going to give you mentorship. I think Hallie has a really great idea there, in bringing in, colleagues, friends, experts that she's comfortable working with that can mentor her students. I think Talk Tools has an excellent levels program where we offer that support, and you take a variety of classes with a variety of instructors, and it's not just about one thing.
Absolutely.
We have to put it all together. And also, we have to be cognizant of that research. You need to learn how to properly analyze research and don't just believe what I say about the study.
Right.
Get the data.
Yep. Yep.
That's really critical. And then the final thought that I would say in that is be gracious to who teaches you. Because I think that the most disappointing thing that I see of having done this, no matter what stage that I get on, or even our conversation today, I will always go back to who taught me, what I learned from them, and giving them that credit. And what's really disappointing to me in our field is everyone that's on social media just posting about a bunch of stuff and never saying where they got it from, who they learned it from. I see my work on social media at least once a day. If not, I would say the average is 5 times a day. That I have to write people and say, that's the Smile Swallow, and it's from the Smile program that has been published since 1997. Can you please cite it?
Wow.
Because what's happening is that trickle-down effect. Someone takes my class, they teach it to someone else, they teach it to someone else, and that person, like, sometimes they don't even do it on purpose. It's the person who taught it to them's fault for not citing the book.
Right.
Right.
Or Lori and I always say, wow, it's great that everybody's talking about the functional assessment of TOTS, but we were the first one to use that terminology, and we never get credit from it.
Right. Yes.
Yeah.
And if you're going to be a pioneer, then you need to be recognized as such, you know?
So sometimes it's frustrating because I'll see people like on TikTok and Instagram that have 20,000 followers, and I have like 4, and all the stuff that they're putting on is stuff that they've learned from someone else. It's not
Right.
their original material, but
Not an original thought.
yeah.
Well,
Casey
don't
from
let you
Explore
get-
Speech and Caitlin, or
Yeah.
they make me look better on social media. They're helping with the Oral Motor Institute, but that in itself, it's like no longer about how good we are as a therapist. It's how many followers we have. And that is really difficult for those in my generation that, I work 13 hours a day, and I'm not sure I want to pay a social media director, a day's worth of pay to get me followers. Like that's not really where I feel is important for me. I want to publish papers and drive the field forward that way.
Right. It's much more valuable.
Absolutely. And we're grateful for that. I'm in your generation too. I just got social media and I have no idea how to use it. So I am right there in understanding where you are in that, because it just, there's so much
And
more.
I get it. It's just the way it is, but we have to be, mindful. Like I'm teaching my class. I went right to you guys. I love this spot, pal. I want to feature it. Give me the slides because I want them to be the right way.
Yeah.
Dr. Zaghi invents something, just wrote him yesterday. Do you mind giving me this new diagram of the tongue? Because I want to compare it to the Kotler rating scale and talk about the changes being cutting edge, but I would never just put it in my class and not ask the person who invented it. Maybe they don't like me and they don't want to be associated with me. But it's just a respect, and citations matter. Copyright matters. So that's something that we definitely, and with artificial intelligence and things like that, it's way too easy to get caught into that trap.
Yeah.
Yep. I know,
A little
it's
scary.
a very scary,
Yeah.
very,
I mean,
very
I did
scary.
it. My friend has Chat GPT. I refuse to get it because I'll get myself. Who's Robyn Merkel-Walsh? Robyn Merkel-Walsh is a pioneer. When I read about myself, I'm like, I'm surprised this thing doesn't know my shoe size. It was crazy. It was crazy.
I know, it is.
Yeah, it's crazy for our generation, and then my daughter's generation is like, it's fantastic. She's in college and she thinks it's the best thing ever. I'm like, there's no need for college because you have ChatGPT. Like, why are we paying tuition? It's ridiculous.
Yes, and there's AI working for a university. I can tell you there's AI scanners and it comes up immediately.
Yeah,
Wow. Well,
yeah,
that's good.
that's really
That
good.
makes me feel better, actually.
Yes,
Yeah.
you want them
No,
to get something
no,
out of
believe
college.
me, the professor knows if it comes from artificial intelligence.
Oh, that's
That's
good.
yeah.
But thank you so much for this. And I
Yeah.
know I'll be seeing you at American Laser Study Club.
Yes, yes, yeah.
we are all
Fabulous.
presenting
One of my
there.
favorite workshops because
Ours too.
so many people are there and it's such a friendly environment and we get to hear a lot of research, which is great.
Mhm.
I'm looking forward to it. So
Excellent. Us
Don't
too.
worry. Yeah.
that'll
Us
be
too.
great.
Yes.
And we just all have to work together to continue to drive the field forward and have some of these difficult chats about, just the struggles that we do have. And all the love and respect to everyone who is out there teaching and publishing and inventing
Mhm.
the beautiful work that both of you have done. And it'll be interesting. We'll see where we're at in a year.
Yeah.
Absolutely.
See if we get that content category at ASHA next year,
Absolutely.
Wow.
2025.
Yes, I have signed the
Sign the petition.
I
Yeah.
signed it already. Thank
Stay
you so
tuned
much.
for Oral Motor Institute, and
Yep.
we're completely nonprofit and volunteer organization, and we hope more people get involved because that's where we can, strive for our advocacy efforts.
Absolutely.
Absolutely. Well,
Yeah.
thank you so, so much for staying late, and I know your day's already long. But this will be tremendously helpful for our listeners, and it was tremendously helpful for us. But even in terms of as we're mentoring this next generation, to have the insight of others as well is always a benefit to us, but also to them.
Yes, take as many classes as you can, form your own opinions. There's a lot of good work being done out there. And the more we learn, the better clinicians we become. There's no right way. There's no better organization, worse organization, better class. They're just different. But again, they come from a core.
Yep, absolutely.
Yes. Thank you so
Thank
much.
you so
Thank
much,
you.
ladies.
Thank you for joining us on this episode of Talk the Talk.
We hope it was enjoyable and educational and further supports you both personally and professionally.
For more information, please check out our Myo and Myo Minute podcast, as well as our other episodes of Talk the Talk. And don't forget to check out our tongue training appliance, Spot Pal, to help with tongue thrusting, thumb sucking, snoring, TMJ, mouth breathing, and so much more. Visit thespotpal.com.